Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Tackling health problems every week, we're joined by a health expert within their specialised field who discusses the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show. And we really hope that this will help guide you in the right direction. So if you suffer from any medical issues or have any health concerns, or for that matter, if you know anybody who does, then tune in each week as we'll be covering a wide range of topics and offering alternative viewpoints from our health experts. If you'd like any further information on our programme or any of the topics we discuss, then please do get in touch at healthshow@islamchannel.tv. And again, we'll give that address at the end of the show. On today's show, we're looking at the common problem of back pain. To talk about this important subject, it's a huge pleasure to welcome Dr. Dia Hussain, who's a rheumatologist from a clinic in London's Harley Street. Dr. Hussain runs a service that offers a safe and innovative laser acupuncture, and his practice attracts patients from countries including the US, Canada, and the Arabic Gulf. He's also been chosen as one of the top doctors in the UK by topdoctors.co.uk. Doctor, thank you so much indeed for coming.
Thanks for inviting me to attend this show.
Well, there's a lot to talk about. It is a huge subject. We'll talk about that more in a while. But before I do talk more with Dr. Hussain, let's have a look at him in action in his clinic in a video clip brought to us by topdoctors.co.uk as he treats a patient for back pain.
Back pain is the most common and costly musculoskeletal condition. It has been found that up to 84% of adults have low back pain at some time in their lives. Most standard therapies for back pain frequently pose adverse effects for GI, renal, cardiovascular, and central nervous system, particularly in older patients. Thus, there is need for non-drug and non-invasive therapies for chronic back pain, which can be used as a first-line drugs. Usually, low-level laser takes several sessions up to 20. Since many patients with low back pain visited my clinic from different countries, for a few days I developed a new method by using low-level laser in acupuncture points to reduce the sessions to 1 or 2 only.
Well, Dr. Hussain, again, thank you so much indeed for coming on the show. We've got a lot to talk about, and I'm going to come to back pain and the amazing treatment that you offer, which is very new and really exciting. I'd like to come back to that in a while, if I may. But first of all, you know, you deal with rheumatism, you deal with rheumatoid arthritis. These are terms that a lot of people, including our viewers, will have heard of before, but maybe don't quite understand what it is. So let's start off with rheumatism. What exactly is it?
Yeah, rheumatism is describe painful conditions of muscles, tendons, ligaments, bones, joints, and this is like it's no inflammation, just pain. Like you have back pain, you have neck pain. Sometime within a few hours, will gone. But the difference now there is between rheumatism and what they call arthritis. Now, many patients said, "Oh, I'm afraid I have rheumatism." He's become upset. I mean, it's just pain. It's not inflammation. Nothing affect or autoimmune disease. This is the difference between rheumatism and arthritis.
And we always associate rheumatism with older people. Is that correct, or is that something that is just one of those old wives' tales?
No, actually, maybe from children until old age, all susceptible to rheumatism. Any pain, anywhere, in joints, tendon, muscles, all this rheumatism. Even as example, if you are like sitting not a good position, then you have pain for a few hours. This is rheumatism. And if you have like you sleep on your hand and you feel numbness, you have pain, And this is just short. Don't be afraid that I have rheumatism, because rheumatism is just painful condition. Sometimes take few hours, sometimes days, and if more than 3 months will be chronic.
And the difference between that, as you said, and arthritis is that arthritis, you'll get inflammation, you'll get other symptoms as well as the straightforward pain. So rheumatism can affect anybody at any age. And
Anybody and anybody.
It can be anywhere on your body. It's almost a generic term for, muscular aches and pains.
And it covers more than 200 painful conditions. It's not just 2 or 3, 4. And usually treated sometime spontaneously, or sometime need to take drugs or physiotherapy.
Well, that was what I found quite interesting. You were saying, and we've all done it, haven't we? We've slept awkwardly overnight and we've woken up a bit sore and sort of achy. At what point does it become just an ache and a pain, a form of rheumatism that actually will go away by itself? And at what point do medical professionals have to intervene to help?
Yeah, as example, if you have pain and just make few exercise and the pain can no need any treatment. But if pain now become more prolonged, few days, few weeks, no benefit from exercise, no benefit from to avoid like bad position of sitting or standing or sleeping, and try to avoid all abnormal position.
Well, that's an interesting one, isn't it? Because we hear a lot about posture. We hear a lot about people in the workplace who maybe don't have terribly good posture. Give us a very brief outline of some of the things that we should or should not be doing to avoid these kind of pains occurring in the first place.
Yeah, as example, if you want to use your mobile, just example, don't make like this, because they found that if you bend like this, like 10 kilos above your head.
Really?
If you make like this, about 20 kilos above your...
Because that's interesting, because people often say, don't they, about using laptops?
Yeah,
sometimes,
laptop and mobile.
Because you're leaning down. So if you can put the screen maybe directly in front of you, so you're not having to lean down,
make like this. Yeah, we advise patient with neck pain or back pain, like make folder or something to hold this either this, that
whatever screen you're using.
Yeah,
so, yeah.
And if you use mobile, try to use it like this, not like this.
Yeah, and likewise, if you're watching, we see many people on the tube and things like that.
And like this, sometimes like this, sometimes like this. All this will increase the pain. And try to be like comfortable, and don't make like this, because after a while we'll be tired. But try to be comfortable.
OK, so there are things that we can do to avoid this in the first place. But then there are people who will wind up having, as you said, chronic rheumatism, when it becomes really bad. And for those people, would it be, if it's still with you, this pain is with you after a few days, a few weeks, then you should maybe go and see your GP?
Yeah, as I told you before, that rheumatism and arthritis is inflammation of musculoskeletal system and autoimmune system. And this is like the body attack itself, what we call autoimmune disease.
Yes. Yeah.
And this is diagnosed by examination, history, examination, and investigation. Like we'll see in blood tests, there is increase of some like ESR, CRP, which tell you that there is inflammation inside the body. This need interference. And mainly if the morning stiffness, you feel very stiff in the morning, there is joint swelling, redness, loss of movement, muscle weakness. This you have to speak with your doctor.
Okay,
about
really
this.
good advice. You talked there about the body's anti-immune system there working. And we talk a lot on this show about nutrition and how we can do things to help us prevent getting these conditions in the first place. So we talked there a little bit about posture and how to sit and how to have our screens directly ahead of us. What about nutritionally? Are there any things that can help our immune system to be stronger so that we have less chance of getting arthritis? Are there maybe supplements we should take? Other types of food that we should be eating?
In 1993, when I supposed to do my PhD, the thesis, I asked my supervisor, I would like to do nutrition and rheumatic disease. He said, oh, this is controversial and you'll find a lot of people against you. And then after 10 years, he met me and said, you are right. There is a relation between diet and rheumatic disease. What we found, I mean, still the people studying about this. As example, when I discovered that patient, when I give him special diet, they said, oh, my joint's better. Because we found some food exaggerate the pain. And some food, try to relieve the pain. As example, some vegetables like tomatoes, spinach, eggplants increase pain. But otherwise, like fish, very good for joint, fish and some vegetables and fruits, you have to take it for joint relief or to avoid some food. As example, like allergic. As example, if you have allergic from some food, you have itching or you have very red face or short of breathing. But some patient has joint pain, swelling. You find like also in gout. As example, if you eat meat and suddenly you will find the swelling of your fingers, mainly the big toe, and swelling, redness, also in rheumatoid arthritis. Because, as example, if you have allergy from cheese, as example, and I give you treatment and the pain relief, and then you take cheese, and the pain increase. And okay, I give you treatment, and then take cheese, and the pain increase, or swelling. Now you have to stop cheese. Otherwise, we'll continue all the time.
And it's interesting that different foods have this effect. Is it the same pretty much for everybody? I mean, obviously allergies are different, but in terms of things like you talked about tomatoes, you talked about spinach being not so good for arthritic pain, but actually what's good for arthritic pain is things like fish.
Yeah.
And what are the vegetables and fruit that is good for reducing your chance of getting pain?
Actually, I have special diet which I avoid some food. Because I cannot avoid, I ask you to avoid everything. Maybe you are allergic to this food, but other one is not allergic.
Okay.
I have give you some common food which usually you are sensitive, and then I ask you to introduce the food one by one. As example, after special diet for 5 days or 1 week, then you try tomato or eggplant. If you are not, you have inflammation or pain, then avoid it.
Yeah. So it can be quite individual. Let's come to backs specifically and back pain. Obviously, posture is a massive part of that, but back pain can manifest itself in very different parts of the back, from the upper, the lower, the lumbar, the
dorsal,
and the dorsal, all those areas. Give us a brief outline of the different pains and what those different pains are often caused by.
Yeah, some patients said, oh, I have back pain. You have to be specialized. Which pain?
Yeah.
Sometimes he said, oh, neck pain. And he said, I have back pain. Where is your back pain? He said, here, up. And some patient, you have to specify which part of the spine, because you have cervical, dorsal, lumbar, and then sacroiliac, and then sacrum. Now, patient, when he come, ask back pain, oh, for how long? Because there is acute and chronic. And
so describe the difference between those two words. So what's acute, what's chronic?
Chronic, more than 3 months.
Okay.
Acute, like sometimes injury or structural change, mechanical, he also this is what bad position when you want to carry things, you make like this very bad. It's supposed to be make like this.
That's right. We've all seen these videos at work, haven't we? How we should lift boxes, how we should lift things so we don't damage our back.
Suddenly, patient said, "Oh, when I feel pain like this, like sciatica."
Yeah.
And I cannot move after that. And this is sometimes need rest just a few minutes and make some exercise, and then the pain will go. But if still continue, you cannot go to the work and things. This is we'll think about. You have to speak with your doctor. Don't.
So the first thing to do is to go to your GP. See your GP, and then the GP will then refer you to an expert who, once he's identified what the problem is, he will then know who to refer you to.
Yeah, as example, if he tried to ask him to do exercise, to be active, the most important, because what they call prolonged bed rest will make osteoporosis. Try to avoid prolonged bed rest. Don't like some exercise which is very harmful for our spine. And then maybe need analgesic, but I'm against analgesic or narcotic because what they cause sometimes muscle relaxant and narcotic, the muscle back and maybe falling down. Mainly people who are 60 years old or above, after muscle relaxant, they said dizzy and maybe falling down. So try to avoid this.
And it's interesting you talk about muscle there, because I've heard before, and you can correct me if I'm wrong, but I've heard that if you actually maintain a reasonable amount of muscle mass, that actually protects the joints and that protects your back because you've got some muscle there to protect it. Is that right, or is that a myth?
Yeah, as example, the most important, you have to keep muscle strong.
Okay.
Because and then you don't sit down if you have back pain, mainly chronic. You don't sit down more than half an hour. Try to, every half an hour, just 10 seconds to go around and then come back.
So going to a gym, taking regular exercise, and maybe taking exercise at work. Say, for example, we hear at work to actually get up from your workstation and walk around a little bit.
Yeah, this is what, because some people told me that, oh, we stay 2 hours, 3 hours not moving. And this is very dangerous. You have to be every half an hour, just try to walk around.
And of course, weight then is going to play a big part here. Are people who are very overweight, are they more prone to have back problems?
Oh, they said if you increase the weight by 1 kilo, you have chance to have osteoarthritis 13%.
Wow.
Every 1 kilo above the average weight.
So a big difference.
Yeah, and then try to reduce also that tummy. I mean, will affect
which one
the
we
back.
all breathe in.
Yeah, affect your back because like something like stretch.
Because of course your posture, if you have too much weight in front, your posture
this is what your
will change.
And for that we asked to make the bill.
Now, in the second half of the show, we're going to talk specifically about the acupuncture, the laser acupuncture treatment that you offer. But until that came along, because that's very new technology, what are the traditional ways that back pain is normally dealt with? How do they normally deal with it before your innovative solution came along?
Yeah, most of the patients with back pain usually resolve spontaneously. No need to interact. Some patients need, the most important, we ask patients to be active. Some patients benefit from exercising and physiotherapy. If the patient not resolved by physiotherapy or exercising, and he has problem in what they call going out, daily life, and then we have to make combination between physiotherapy and psychosocial therapy. because we need reassure the patient, because he is, if he has severe pain, he cannot go out. His social life will become disturbed.
And actually, then the problem gets even worse because they're
Yeah.
not. It becomes a vicious circle. Lack of exercise causing more problems. Now we've got a lot more to talk about in the second half, and we're going to specifically talk about the solution that you have, which is very new. I'd never heard of this before. I've heard of acupuncture before, and I've heard of lasers before, but not working together. So I'm really interested to see how that will be. So thanks so much for the moment to give us a background of rheumatism, arthritis, and back pain. And we look forward to talking more in the second half to find out how we can deal with it with this new technology. Now, we must stress, though, that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Lots more to talk about, so join us after the break, and we'll continue to talk about today's topic of back pain. Don't go away. Welcome back to the Health Show, where we've been talking about back pain with Dr. Dia Hussain, who's a rheumatologist from London's Harley Street. Now, elderly winter swimmers brave below freezing temperatures in China's capital, claiming the icy waters are the secret behind good health. But how about back pain? Is it good for that too? Well, let's take a look.
This 这就是一个习惯过程。最开始冷的时候也挺怕冷的，慢慢习惯了。现在不来吧，早上起来第一件事，我们这叫黎明队嘛，第一件事就是来游泳。起来第一件事就是游泳，游泳完了一天精神特别好。至少就是说我耐寒力强了，也不那么怕冷了，因为我这是股骨头坏死，开始不敢游，后来游了以后没有什么感觉的不适的感觉，所以我就坚持。
就像针灸似的，那浑身都给你就灸一下子的，你是啊，使你的血液呢循环起来的，你是这样循环起来以后就不会拥堵那血液，所以对身体肯定是有好处的啊。
Now, watching that makes me shiver.
Yeah, me the same.
But we do hear about this, don't we? That, how getting the body really cold on the outside is we heard the lady there talking about it's like acupuncture. Does it actually do any good for the muscles?
Really, some painful condition, we ask patient to put his, as example, leg in very cold water with ice and remove it to hot water, like alternative. And this is good, very quiet, good for patient with plantar fasciitis, like tendinitis. We ask carpal tunnel syndrome. We ask patient to put his hand very cold water with ice and then put it in hot water, warm water, and then again make it choke. And this is very, but instead of go to China, come to my clinic. No need to.
And we often hear, don't we, if you have a swelling or anything like that, just to get a bag of frozen peas from the freezer or something.
This is what, if they have inflammation, you have acute condition, you put ice. But if you have chronic thing, you put hot bag.
Okay. Now, we heard in the clip there, they were talking about acupuncture, that the sensation is very similar to acupuncture. First of all, we hear that term as well. Many people might have tried acupuncture, but many people not. So explain exactly what acupuncture is.
Yeah, acupuncture is like a needle, exaggerate the body to increase, stimulate, increase, natural products, such as endorphin, which painkiller, or serotonin, which muscle relaxant substance. And this is they imagine that in acupuncture, that the body chakra or there is a line, and if you have problem, that something in the line block the line. And then when they make acupuncture, open this block.
It's amazing, isn't it? Because that technology, is so ancient, isn't it? The whole concept of acupuncture.
Years before.
And we hear about, as you said, about the chakras in Indian culture being used. So this is very old, traditional system of helping people. So acupuncture is something that the body and we're all very used to. But you've now introduced lasers. How does that work?
Yeah. Now I add something on acupuncture. That how they discovered that acupuncture. Somebody when they like before would put in his chest and the pain relief, and they said, that is point good for acupuncture.
One of the things that's quite interesting is the fact that we sometimes have a pain at this part of the body, yet it's actually come from somewhere else, or vice versa.
Yeah.
So it's almost like these chakras or these lines of energy flow through the body and somehow transmit the pain from one part to another.
Yeah, what I give you example. Sometimes you feel water coming in from here, and then you close it, and then you find it from here, and then close. Try to see the original.
Right.
You have to stop the original. I ask a patient. Some patient go, I have headache. Just take paracetamol, because a lot of causes for headache. As example, maybe teeth, maybe something in sinusitis. You have migraine. You have neck pain also. Could affect the headache. Make headache.
So in other words, one pain could be caused by something completely different.
Yeah.
And with acupuncture, the way that that works is it just taps into that energy line and unblocks it.
Yeah, as example, for back pain, there is acupuncture points here. For hip, here. For knee, as example, here. For shoulder or neck, here. This is like exaggerate the body to increase endorphin or serotonin production.
Now, normally that's done through a needle, isn't it? A very, very fine needle. So how do you do it? Because you don't use needles, you use a laser. So what's the difference, apart from the obvious?
Yeah, my approach, usually, I try to treat the patient as a whole, not just to physical illnesses. I try to treat for environmental, nutritional, and social, anything about his emotional problem. I mean, if as example, I treat you and still you have thinking a lot of people against you, attack you in the home, at home, talking about you, no benefit from my treatment. You have to treat the patient as a whole, not just. You have to treat the causes, not just symptoms.
Okay.
So I try to, because I have many patients from different countries, I try to summarize our very concentrated treatment. I make a combination between acupuncture, laser acupuncture points, and I use reflexology points and acupressure points. Because I discovered that some patient went to some acupuncturist, and then patient told me I found a 5 session but no improvement. And I told the patient, did he do this point? He said no, he didn't do it. And I asked as other patient, he said after seven session I feel improved, because he didn't put all the points in the one session.
Yes. Yeah.
They make it after 7 sessions. Because, as example, if I make all points in 1 session and you improve, it's not, you are not coming tomorrow or after 2 days, 3 days. Oh, okay, no pain. For that, I try to make concentrated session to be, the patient will be happy from the first session. Okay. And my rule that the patient will improve, or the patient will feel improvement from the first session. Because if no improvement, I ask the patient no need to come again. So but if there is improvement,
that's very good.
Okay.
Now, we'll have a lot of ladies who will be watching, and they see you, they see the treatment that you performed. In your clinic, I presume you also have female therapists, female clinicians who can also do this. So if a lady comes along, she can be looked after by a female practitioner.
Actually, this is in Turkish and in Saudi Arabia, but not in London, because I'm doing this my own. Because I feel, I'm only the one do this in the world. But I teach people how to do it. But until now, I didn't find female. So because no need to, the patient, I need the patient hand and ear and feet. Also, I no need to,
So the patient keeps their clothes on at all times?
Yeah,
okay.
all the time.
Okay.
Just I need hands, because there is points in the hand, points in the ear, and points in the feet, mainly.
And that's it.
And maybe 1 point here, but no need to, will be covered all the time.
Now, this technology, using a laser, how did you get the sort of clinical trials done? How did you get to the point where you are now trusted by the health service and the authorities to try this technology? Because, as you said earlier on, people are always a little nervous of things that are new, whether they're safe and whether they work. So how did you overcome all of that?
Okay, this is FDA approved that there is no significant side effect. And this can use...
And FDA, that's the American Food and Drug Administration, isn't it?
Yeah, it's approved that there is no significant side effect.
Okay.
Even some patients, they said you can use it in pregnant, but we try to avoid this, because if they said no problem in the pregnant, but anything happen for pregnant for other causes, maybe from laser. So we try to avoid to do that with pregnant women.
Explain exactly how the laser works. Is it reproducing that same effect of a needle going into the body? It's doing the same, but without an actual needle?
Yeah.
Is that how it works?
Yeah, this is what they call the same mechanism of acupuncture, but instead of the acupuncture give you just a short period and need repeat, 6 sessions or 12 sessions. But this one, in addition to mechanism of production, serotonin and endorphin, and also make anti-inflammatory effect. This is and why I make a pressure to add acupuncture plus acupressure, and try to choose also reflexology points. Instead of with my hand, I try to make pressure with the laser. And sometimes it's painful, but what they said, if no pain, no gain.
Well, there is that. So in terms of the pain, though, because we often hear about lasers. We talked a while ago about using lasers for everything from tattoo removal to all sorts of areas of medicine today. So describe the experience for the patient who comes in to you. How long would they come in for? How long would the session last? And what actually happens during that session?
Okay, I did the study. I compare 20 patients with acupuncture and 20 patients with laser acupuncture. And I found a big difference. Like acupuncture gave me short improvement, but laser acupuncture gave me up to sometimes 3 months, 6 months improvement from the first session. Some patient, I didn't feel improvement. If no improvement, I said no need to come. But if there is improvement, sometimes said, I have 70%. And some patient said, after 24 hours, I have pain, severe pain. No, don't worry. Maybe up to 48, sometimes the pain exaggerated. So I have about 70% of patients from the first session improve completely. Sometimes I said, just 20%, 30%. Then we need another session. I try to reduce. It's supposed to be between 6 to 12 sessions, but I try to make it in 2 to 3 sessions.
And how about after they've had the treatment? Is there anything that they need to do? Are there any exercises? Is there any other follow-up for them to do?
Yeah, it's very important that physiotherapy also, we need to continue physiotherapy. Some patients said, no improvement because no exercise, no physiotherapy, and also diet. we have to strict on special diet.
And when you say special diet, what would that involve?
To avoid like meat, chickens, special for just few days.
Because that would inflame.
Increase the inflammation, increase pain.
Okay.
And then just few days, and then I said, okay, you can eat after.
And are there any conditions that you can't help with when it comes to back pain or other kind of pain? Is there anything that doesn't work with this treatment?
In complementary medicine, they have different types. They have osteopath, they have chiropractic, they have Alexandra technique, you have Ayurveda, you have acupuncture. And if this, as example, this method not work, they try another method. But it's good to make combination. As example, when I finish my laser, it's better to continue with physiotherapy. Because when I make laser, I increase the pain, the increased production of pain relief, for pain relief and muscle relaxant. But we need to be this one very strong, the muscle. If the muscle weak, I cannot do by laser acupuncture just one session. We have to continue in your home. We need educating the patient that you need to continue exercise, to avoid, as example, if I do laser acupuncture and the patient can next day will say, no improvement.
You can't go back to your old routines again because that's obviously what caused the problem in the first place.
This is very important to
Now, obviously, you're using the very latest technology. You're based in Harley Street. Some people might be a little scared that this is going to be quite an expensive process.
Yeah, for that, I give 20% off for patient coming from Islamic channel.
Okay. Nothing like a blatant plug. So 20% off. If you've watched this show and you go to him, you're going to get 20% off. Give us an idea of the sort of costs involved here.
Yeah, as usual, that 250 for consultation in Harley Street. You know, Harley Street is very expensive.
Yes, yes.
They try by feet, square feet, not by... and after consultation, then decide about the session, how long it takes. And the session usually for 450, I mean, altogether 700, and then we'll 220% off. Because what I'm doing, I don't like to, as example, today I will do session, after tomorrow session, 3. I try to make it one session. Although a patient will pay, but pay one go. No need like installment. When as example, I give you 20 pounds every for 10 days. No, give me 200 in one day. It's better. And I found 70% improve back pain, 50% osteoarthritis, both knee, and about 70 to 80% for neck. I mean, it's not all patients will improve. I told you. I mean, there is no in medicine 100%.
So there isn't a guarantee that this is definitely going to work.
Some patients said, could you give me guarantee? I said, I'm sorry, I cannot give you guarantee.
Okay. But what is your success rate? What do you find with people that do succeed, that they walk away and assuming that they do then take your advice about better posture and not continuing the bad habits that got them into this painful situation in the first place? What kind of percentage success rate would you say you have?
Yeah, this is what I told you, success rate. 50% for knee pain.
Oh, I see. Yes, you did.
And
yes.
70% for back pain. And some patient come, he said cannot bend, and after the session, he can touch his toes. But it's not all the people. I mean, the people is, if the people, I refer patient to surgeon. I mean, it's not all the patient improve.
And at the end of the day, it's like everything medical, isn't it? There's no such things as guarantees and 100% success rate, because that's the nature of medicine. But coming back to the actual treatment itself, this equipment, how new is it? How new is this technology of using a laser instead of needles for the acupuncture process?
Actually, this is old method. I mean, more than 15 years. And FDA approved that 2002.
Okay.
But
so it's been tried and tested.
Yeah, tried and tested. But usually, I told you, as we learned, that you need between 6 to 12 sessions.
Okay.
What I'm trying to modify this one to make it in one session. Because usually I come London every month, because I have Saudi Arabia, I have in Istanbul, in the future another country. But for that, I'm just 1 day. And patient who not improve, I said, no need to come. But if there is improvement, and he said, okay, 2-3 months, but after 2 months, pain start, and then we'll do again.
Is there anyone else in the UK that does this treatment, or is it a really rare treatment? Really rare, is it?
Yeah.
Okay. Wow, it's amazing to hear about it, and it would seem that many other doctors should be getting involved in this and should be adopting this technology because it's quicker, it's easier, less invasive. It's got a lot of things going for it.
Maybe, but some surgeon doesn't like us because the problem, you cannot ask every patient to go to surgery. It's difficult to go to surgeon and try to make conservative treatment. If there is no improvement, then go. Many patients told me, oh, the patient, when I saw the doctor, oh, he said, you need the operation. And why try conservative, which like this one, if no improvement? But some patient, if you see the MRI, and the patient cannot move, this is not, I cannot help him.
And it's remarkable, isn't it? You know, anybody who I'm sure is watching who suffers from back pain, they're prepared to try anything because it's such a debilitating condition for people to have. And again, just very, very briefly before we wrap up the show, the things we should be doing to avoid this problem in the first place.
Very important points about non-steroidal, because many patients, I take tablets like non-steroidal anti-inflammatory, and they said the second substance affect kidney after diabetes, non-steroidal. Many patients I have from non-steroidal, they have renal failure. So don't eat drugs for over
Well, I think you said it before, didn't you? You know, we shouldn't be dealing with just the symptom. We should be looking at the cause behind it. And it's been really fascinating finding out a little bit more about rheumatism, about arthritis, about the big, big issue of back pain, and also very exciting to hear about this technology as well. So thanks so much for coming in. We really appreciate it. Thank you.
Thank you.
Unfortunately, that is all we have time for today. I'd like to thank our guest again, Dr. Dia Hussain, for coming into the show to discuss today's topic of back pain, and also to tell us a little bit more about the alternative treatments that are available. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out more about this or any of the subjects that we discuss on the show or throughout the series, please do email us at healthshow@islamchannel.tv. That's healthshow@islamchannel.tv. Join us again next week, but for now, it's goodbye for now. Assalamu alaikum.